almost left. So, good to be with you guys, and while the judges are deliberating and making their decision, I'm going to say a few words about this whole startup, venture, innovation ecosystem and what's really going on out there. And perhaps from my own experience, I can share a few key takeaway lessons to keep in mind as we tackle all the many problems in healthcare and trying to build realistic solutions for them. A couple of words about my background. I started out as a lowly cardiologist and was involved in development of technologies in healthcare early in my career, and decided that I wanted to be on the business side of healthcare. Went back to business school and worked at McKinsey for a number of years before starting my own company back in 2011, 2012 timeframe, at the inception of digital health and after the passage of the Affordable Care Act. And for the next 7 years, I was running a company that sold population health management software to health systems and life science companies. And you think if you've been a cardiologist, you've built products in healthcare, you've been a McKinsey consultant in healthcare, you know something about healthcare when you finally start your company. But very quickly I realized, once you're on the vendor side, I was a big zero. And I really did not know anything. The learnings from actually being on the other side are enormous. For the last few years, I wrote the AI Doctor book where I wrote about the experience of bringing innovation into healthcare and shared some of the lessons, or a lot of the lessons that I'm going to discuss today. And the few things that I want to mention to you guys is, number one, in 2010, there were 10,000 venture-backed companies out there. Today, the number is 61,000. What does it mean for you? It means it's a lot harder to raise money, and the capital is increasingly concentrated. In 2020, 2021, when interest rates were zero, when there was a lot of fiscal stimulus being pumped into the economy, the venture industry went wild. The amount of venture investment exploded, often at very high valuations into companies with flawed fundamentals. What that has meant is there's a massive shakeup going on in the early stage investment industry. A lot of funds are closing their doors. They cannot raise follow-on funds because of the performance of their previous investments from the 2020, 2021 timeframes. The large firms you hear about, like Sequoia and Lightspeed Ventures and Kleiner, they have re-registered as investment advisors. Even they're having a hard time raising money from institutional investors, so they're trying to tap into the private wealth channel and getting raising money from retail investors. So also you have the passage of the recent legislation that's going to cut about $1 trillion from Medicaid. There is the site neutrality and the 340B, which is going to push down drug prices. All of this is very relevant for anybody building a health AI company. One of the first things you need to understand in this space is the fact that in any space, but in healthcare, because if you're selling to healthcare providers, they have very thin margins. A lot of them operate at flat or negative margins, so they don't have a big budget for innovation and buying a lot of new tools every year. So they focus on very mission critical unmet needs. They can only buy one or two things a year, And even at that, their track record for bringing it in and scaling it up within their organization is absolutely horrendous. A lot of healthcare, I mean, there are some good products that were pitched out here in the last few minutes. My first question always is, even if you're a genius and you're creating a great product for a mission critical unmet need that everybody needs, can you really sell it to these institutions that are used to buying from large vendors? There's security, they don't know if you're going to be around next year because you may not be able to raise more money. If you look too young, too smart, they may not trust you, you may not be speaking their language. So thinking through whether you can actually sell the product, who's selling it, is it someone that can relate to and trust is really, really important. So focusing on mission critical unmet need that rises to the top of the list is critical, but also thinking, do I have the credibility to be able to sell to these very conservative institutions? And providers are the most difficult. Life science companies are a little easier because they have real business models and they have better margins and so forth. And in an environment like this, where capital is becoming concentrated, there's a lot of noise because the barriers to creating companies are lower. Open source foundation models allow a lot of people to create products and be out there. That creates noise for the customers of these technologies. And the number one issue that I'm seeing out there right now, speaking with the stakeholders in this space, is confusion and being overwhelmed. They don't even know where to start because everybody's coming in, everybody's saying, I'm gonna make you rich, I'm gonna make you famous, my product's gonna do this, my product's gonna do that. They figured out they need to have a spreadsheet that shows revenue gains, cost savings. So they're seeing that, they're becoming numb to all of this. So you cannot do enough research up front. Good quality research, not asking a stakeholder if they like your product or if they're gonna buy it. When I was at McKinsey, the kind of research we did to validate a business model involved putting different things in front of them and saying, where does my product rank in your list of priorities? Your competition is not people making the same product as you are. It's the total dollar amount that's being squeezed by the Medicaid cuts and site neutrality and so forth. So product completely unrelated to you may get their dollar because it addresses the key unmet need, and it's being brought in by their brother-in-law. So that's where they spend their money. So pay attention to the intangibles in order to fully validate your business model up front, and think if you want to spend the next few years of your life doing this without achieving an exit. 61,000 companies also means your exit options are much more noisy. The acquirers are facing a larger batch of companies that they can acquire, and if the last few years have been any indication, the public markets have been very tough on digital health companies when they've gone public. The index tracks the S&P 500 and so forth. You done? Okay, all right. Good luck to all of you.